Hey, this is Carmelle. This is Carmelle's World, and I'm back. You might notice from a Headscarf Chronicle, same t-shirt. Yeah, I'm making these videos. I'm pushing them out back to back. I am not changing the t-shirt, just push out a video. Okay, people? Raw deal, real person, real time, real scenario. At least you know you get real. I'm coming to you with a rather sensitive topic because it has to do with mental health. And it's about bipolar disorder. Now, let me give a disclaimer. I'm not a psychiatrist. I'm not a therapist. I'm not a psychoanalyst. I'm not a social worker. I'm not a licensed clinical social worker. I'm not a doctor. I am not any of these people. But what I am is 52 years old, experienced in life. After all, half a century in. Now, you'll say, well, how you going to talk about bipolar? That's something that, unless you have it, you ain't going to understand it. Well, I agree. The reason why I can talk about it and expound, because I got my trusty dusty, because of course I had to make notes, because there was a lot of stuff I found out about this disorder as I researched it for you guys. But I have it. Yes, Carmelle has it. Bipolar 2. Not embarrassed by it. A lot of people in this country have it. It's, I'm not going to say it's a large number, but it's enough of us out there. There's bipolar 1. There's bipolar 2. And then there's a couple of other disorders that come along with bipolar 1 and 2 that just kind of hover along with it. But y'all will hear it in a second. Okay. I'm sucking on a cough drop because I don't have a cold, no kind of COVID, Omicron, Delta, and all the rest of the people, they ain't got me yet. But my throat and my nose, yeah, my allergies. So please forgive. The definition of bipolar is a mental condition marked by altering periods of elation and depression. Back in the day, back in my mama's day, it was called manic depression. Because you have mania, which is when you're up, and then you have depression when you're down. It's a health condition that causes extreme shifts in moods that alternate switch between highs or mania, like I said, or lows, depression. In some cases, they can last a few days, hours, weeks, even months. Sometimes these cycles are so strong and so close together that it's difficult to maintain a normal life or have normal relationships. That is very true. Sometimes you can be so depressed or down, not feeling like you want to be part of a relationship, not feeling like you even want to relate with people. Marriages have known to suffer, relationships have been known to suffer. Just people in everyday life, friendships have been known, family, kinships have been known to suffer. It's a serious disorder, okay? When it's left, especially if it's at its height and it's not treated. Sometimes, okay, read that already. This is a subvariety of bipolar disorder called rapid cycling bipolar disorder. There is, rather. Sometimes it's easier to identify the depressive episodes than the manic episodes. Reason that I say that is because when you are depressed, it is obvious. You lack energy. You lack wanting to interact with people. You just want to be by yourself. You might even want to be in the dark. You don't cook. You don't clean. You might not even bathe. Yeah, it can get that bad. And you just want to be left alone. You feel hopeless. You feel like you're useless. That's obvious. People on site can see that that's obvious. Mania is a little bit different because some people are just naturally hyper. They just all the time. They just naturally are like that. They just have a high energy level. So when they're manic, it's like boil a bunny 5,000. It's like I'm already at 500. I'm now at 1,000. Woohoo! And you just pew off to the races. But once again, if the person is naturally energetic, it can be hard to actually see because you're thinking, oh, that person, she probably just had some coffee. She had a Monster. She had a Red Bull. That's all. She just happy. She just, yeah, that's just her. Regular depression, a depressive episode, includes prolonged sadness, irritability to concentrate, or lack of being able to concentrate, loss of energy, difficult sleeping, and thoughts of suicide. Yes, you can get to the point when you get so depressed that you just don't see a purpose in even getting up in the morning. You don't see your purpose in the world. You don't see that you have a purpose in the world. People with these mood swings have more unpredictable mood swings. They're also more irritable and deal with guilt, feelings of restlessness. They move slower, they speak slower, they sleep a lot. Sometimes they gain weight, sometimes they lose a lot of weight. Sometimes the behavior might be more obvious by medication side effects. Now, there are some medicines out there that will give you a depressive episode. It will send you into depression. Sometimes you're taking the medication for one thing and all of a sudden you just start feeling down and you just start feeling sluggish and you just don't feel like doing nothing, and it's like, okay, I'm taking this medication, why am I it's helping me to see better, but all of a sudden now I feel like I want to go lay down somewhere and take a nap. Manic episodes are often harder to find out. During these episodes, they feel frantic, hyperactive, or overexcited. If someone has upset them or enraged them, it is interested in them. They are thrilled, excited, beyond reason. Their energy level is usually higher than normal. There are 5 signs: abnormal or excessive elation or energy, racing thoughts and speech, grandiose thinking, exaggerated sense of one's importance, power, identity, or knowledge. All of a sudden now you are the boom dada. You are the queen of Sheba. You just you that bitch. Excuse me, French. Decreased need for sleep. They stay woke for hours, may not even need sleep for days at a time. I'm going through that right now, people. Yet they will be full of energy and lack sleep. I have to cycle through this real quick. Put your hands over your ears, babies, if you got little ones listening. Hypersexuality. Increased sex drive, may have unusual demands sexually. They may experience such things as increased sex drive, sexual fantasies, make inappropriate sexual advances, have affairs, spend lots of money on porn, prostitutes, etc. Poor judgment. They have an inability to complete tasks. This is a strong sign of bipolar. At home, there's full of unfinished projects. This could affect you in your work life also, because your boss will tell you, oh, I need you to go do this project for me, or I need you to go get these files for me, or I need you to go downstairs and talk to so-and-so and tell them I need this, that, and the third. And you'll get all these things started, but you won't complete any of them. You might get out of the 4, you might get 1 completed and a bunch of maybes. Irritability. Their mood swings are more intense and disturbing. The types of bipolar, there's bipolar 1. This involves manic episodes lasting 7 days or more, or severe mania that requires hospitalization. Depressive episodes may last for 2 weeks or more. This doesn't have to be in that order for you to have bipolar 1. Bipolar 2, which is what I have. This comes with both manic and depressive episodes, but the mania is less severe than bipolar 1. Doctors call it hypomania. Hypermania is a lot, hypo is less than normal or none. A person with bipolar 2 may experience a major depressive episode preceding or following a manic episode. What happens is you will go through a manic episode where you are, I will wash the dishes, I will fold the laundry, I will do the floors in the kitchen, I will wipe down the stoves, I will go in the bathroom, and I'll start all these different projects, right? I'm probably going to get to all of them because I have all this energy and I have to just but then all of a sudden that high gets low and it starts to wane off a little bit, and I start to feel tired, and then I get more tired and more tired. Now I get sleepy. Now all I want to do is lay in my bed. All I want to do is just lay in the bed and just go to sleep. I don't want to move. I don't want nobody to call me. I don't want to deal with nobody. Life as I know it has ceased to exist while I'm in this condition, because I don't care about what you need unless the house is on fire, or the rent is due, or the electric is due, or the landlord is at the door for whatever the reason, and I might not even answer it then. I ain't getting back my bed for nobody. There is disorder called, and please work with me with this name because I don't know how to say it, cyclothymic, cyclothymic, I just murdered it, I know, but forgive, disorder, also known as cyclothymia. Symptoms is hypo or less than mania, and depression that lasts for 2 years or more in adults or 1 year in children. These symptoms do not fit the criteria for all manic or depressive episodes. Then there's other types. These people experience symptoms that do not fall in the above categories. Usually they come with these because of drug or alcohol or medical conditions. Sometimes you'll have a medical condition which will bring out your bipolar. Certain types of hormonal imbalances will bring out bipolar. Let me think. I can't think of anything else on that one, but I'll come back to you because it was something I wanted to say and I forgot what I was going to say. Bipolar 1 and 2 are the most common subtypes, with bipolar 1 being the most severe. People with these disorders will have episodes where they have no symptoms at all. Now, I may go weeks with no symptoms whatsoever. I'm cool as a cucumber. Everything is woo-sa. Even on the medication, you will still have your highs and your lows. The thing is that they won't be up here or down here. They'll be woo or woo. They'll be more manageable. You'll know when you're having a hyper episode and you'll be able to calm yourself down. You'll know when you're in that depressive state. And you'll be able to pull yourself up out of it quicker than just staying there and just laying and staying and playing. No. One of the good things about being on medicine. Now, don't get me wrong. You don't always have to take medicine for bipolar. Sometimes it requires therapy. You start to recognize your symptoms. You learn techniques on how to handle them. And if they don't require medicine and you can handle your mood swings, kudos. My mood swings over the years went from woo to whoop to whoop, 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 whoop. I couldn't do it. It was driving me bananas. And my anger was coming out during my manic episodes. So I was mean as a rattlesnake when my hyper side came out. In my other video, my previous video, Headscar Chronicles, with the anger management one, and there's a part in there where I said I've called the police on myself. I've had to call the police on myself because, yeah, my anger, my temper was so bad till I knew if I didn't call the police on me, they'd be coming back to get the other person. Now, we're going to discuss mania real quick. Anger or irritability, reckless behavior such as sexual activity, difficulty sleeping or needing less sleep, periods of high energy levels and or periods of overactivity, high self-esteem, restlessness, irritability to make decisions, intense enthusiasm and excitement, loss of concentration, racing thoughts. That's another thing, racing thoughts. Pleasure-seeking behavior, i.e. sexual activity, alcohol, drug use. Manic episodes can affect the person's daily life, job, and relationship. Yes, they can, because if you are constantly here all the time, that will drive somebody absolutely bonkers. They can't sit down because you don't want this crease on the carpet, or you don't want the crease on the chair. You don't want them to drink out the cup because you got to go wash the cup. Now you got to go wash the cup. You don't want them to make dirty clothes because now you got to go, you wash not a load of clothes, you're washing a shirt and a pair of pants because you don't want any dirty laundry in the house. It will drive you crazy. Okay? That's why when you find out, when you start having these symptoms, seek attention. Go talk to somebody. Find out if you have it. Discuss your options, your plan of how you're going to handle it. So this way you can get some help. Because you may need it. Some people, you got people walking around every day with it. Don't need no help. I'm proud of you. I did. I was not one of those people. Sorry. I wasn't. Depression, fatigue or low energy feeling of hopelessness, insomnia or sleeping too much, a loss of appetite or overeating, loss of concentration, low self-esteem, a loss of interest in things that once enjoyed or did, physical aches and pains with no obvious cause, suicidal thoughts and behaviors. For health professionals to classify these symptoms of depression, they must have had them for at least 2 weeks. Okay, now the cyclothymia, the one that I messed up early, is a very rare mood disorder. The mood shifts in cyclothymia aren't as extreme as the people with bipolar disorder. People with this disorder typically can function in daily life, though it may be difficult. Symptoms include occurrence of irregular intervals, not continuous or steady, psychological highs and lows that may become more pronounced over time. The treatment usually involves counseling and therapy. In rare cases, medications may be used. You heard that, rare cases. It's rare, less than 200,000 cases in the U.S. per year. Now, I want to talk to you guys real quick about mental illness, bipolar disorder, depression, any disorder mentally, for real, and the black community. It used to be a time where we didn't get help. You always got that crazy Aunt Betty at the top of the steps in the back that don't nobody mess with because, she wear a wig on sideways and she look at the television that ain't come on since 1976. That last show she saw was Red Fox. Yeah, her. Nobody went and got help for people like this. But it was clear there was something wrong. We just didn't go get help. We just kind of ate it. We grinned, we bore it. You know, we just, you have a lot of mentally ill people that are walking around that need help, that are African American or people of color. But because of belief systems that are archaic, outdated, or just fear, period. Because nobody wants to be labeled. See, people, when you say you got bipolar, or you're depressive, or you're manic, or you have ADHD, or you have schizophrenia, or something like that, people will label you crazy. Nobody wants to be labeled crazy. First and foremost, I am not crazy. I'm thoroughly misunderstood, but I'm not crazy. And we have to start getting help for ourselves. We deserve help. Things that have happened to us, injustices that, that old cliche, what happens in this house stays in this house. The devil is a damn lie. Get help. Get help for your situation. You may be mentally ill and you have a feeling and you don't want to admit it. Go seek out, find out if you do. And if you do, take care of it. Take care of you. Don't walk around hurting. Don't walk around depressed. Don't walk around happy boiler bunny. Don't walk around hearing voices. And these voices are telling you to do things to people that you know will harm them. Or you seeing things that you know ain't there. And see, I can get into the spirits and the ghosts, but that's a whole nother video. Don't worry, coming soon near you. Get some help. Seek attention. And by attention, I mean medical. And by medical, I mean a therapist. Because normally the channels that you go through is not directly to the psychiatrist unless you got that type of insurance. Us color folk. No, y'all ain't heard that one in the month of Sundays. We don't have that. Generally, we don't have that type of insurance. Where I live, there's about 4 good insurances. Out of the 4 good insurances, only 2 of them will guarantee that you can get good mental health help. They all have a mental health program, of course. But I think these 2 particular ones are really, really, really good compared to the other 2, which are adequate. They're good. But the 2 that I know of are really, really good. And get you some help. Go to your therapist, because that's usually what happens. You see the therapist first. The therapist then ascertains what the problem could be. And if you need to speak to the psychiatrist, because you may not need to speak to a psychiatrist. You may just need therapy. You may just need group therapy or one-on-one session. And if you need medication now, they say, well, if we offer you medication for your condition, for your situation, would you mind taking it? If you say no, because that'll help these racing thoughts, that'll help this post-traumatic stress disorder, that'll help these voices in my head stop talking, then you see the psychiatrist. The psychiatrist will then go over what you have to go over, and will ascertain at that point if you do need medication with the condition that you are suffering from or not suffering from, you just going through. And because suffering is just a form of speech. But they will then write your prescriptions and set you up with your therapist, who will probably already have you already set up with another appointment, and then you'll start your care. Better you go get some help, or find a loved one that you know needs the help and help them to seek out help. Rather you take them to the doctor than you get dressed for their funeral. because that depression got them to the point to where they didn't see a point anymore. And I know that's off the deep end, but that's a very real case scenario. Or it drives somebody crazy to the point to where they're driving everybody around them crazy. You want to help. You want to get some help. You want to try to help somebody else to help themselves. Please. Mental health needs to be addressed in our community. It needs to be talked about in our homes. You need to have these conversations with your children, with your loved one. If you start noticing signs and symptoms that just seem like they off the beaten path for this person or this person's personality. Each one, reach one, teach one. Sometimes you gotta teach somebody how to get help for themselves. Maybe they need you to hold their hand when they go. And if you can be available and try to be available, go ahead on and be their right hand. Sometimes we just need to know that somebody cares enough. And it's not embarrassing. That's another thing. It's not embarrassing. You need help, get it. Please. Okay? This is Carmelle talking to you. You know, I ain't gonna tell you nothing good or bad. I'm gonna tell you some good stuff. Let me correct myself. I'm gonna tell you some good stuff, but I ain't gonna tell you nothing bad. And we are at 26 minutes. I am about to close out. I loved having this conversation with you. Thank you for giving me some time. Like, comment, share, subscribe. It don't hurt nobody to subscribe. All you got to do is press that little button, press that bell, get your notification buttons on so you know when I put up another one and another one and the other one. Go back and revisit some of the ones, not the very first one, please. That one was embarrassing. That live, I don't even understand how it got 23 views, but it did. But the other ones, visit them. Maybe something in there you can use. Maybe you could see something in there somebody else could use, and you could pass along the information. However you do it, just do it. You guys are my soul tribe. I'm trying to throw that information out there to you. I'm trying to make sure that my people are informed, because a well-informed community and an educated community is a thriving community. You know what I'm saying? Get them a comment. Give me some love. Show me some love. Give me a heart. Let me know you made it. Give me a like. Don't hurt nobody to press that button. Nobody. It ain't gonna hit you back. Press the like. Let me know that you made it through, or at least at some point, maybe you've liked it. You like something about it. You like the information that I shared. Something that maybe you didn't know something about. Like it. Give me some ideas. Lord knows I could use them. Give me some ideas. Get down in the comments. Talk to me. Share with me. Tell me what it is you want to see. Tell me what it is you want to hear. Tell me what it is that you say, you know what, Carmelle, I want you to do some research on this, that, and the third, because I'm curious about this, or I want to know more information about that. I got you, because you're my soul tribe, and I love you. And with that being said, at 29 minutes and 28 seconds, this is Carmelle in Carmelle's World, and I'm out.